At Lennox Health in downtown Manhattan, telemedicine has become an essential service.
Hello, my name's Dr. Merson. Nice to meet you.
These video-equipped workstations allow physicians to conduct virtual consultations with psychiatric patients at 17 hospitals across New York State. The technology here means this facility can provide around-the-clock care without physical contact, and it has even increased its coverage.
During COVID, there was an expansion of the use of telepsychiatry. Certainly on an ambulatory basis, with patients at home, with psychiatrists and other behavioral health providers at home. Here, this program, we saw an expansion in how much our program was utilized. So we covered places that we had never covered previously.
And it's not just hospitals that have been embracing remote care during the coronavirus pandemic.
I did it with my physician just because I had a cold. And basically you set up this portal type thing, and it's almost like a FaceTime call.
And I tried to shift as much as my medical care to simply messaging via text.
Whether it's for a video chat with your GP or easy access to test results, consumer use of telehealth has skyrocketed. According to consulting company McKinsey, the number of Americans relying on e-health has increased from 11% last year to 46% today.
US virtual primary care platform PlushCare says revenue is up 500% year to date, and telemedicine software provider Amwell says it facilitated up to 45,000 visits per day during the US peak of the pandemic in March and April. That's 2,000% higher than the same time last year.
We thought a lot of virtual care visits were going to come from suspected COVID-19 symptoms, and what we've seen is that it has been primarily focused on maintaining continuity care for chronic care patients, and also being a lifeline, right, for patients that have urgent symptoms or just need routine care.
The US government has made telemedicine more available under the federal health insurance system for people over 65. New York State also waived some fees for virtual visits to encourage patients to seek medical care from their homes. But there are bumps on the road to widespread adoption.
I think some of the potential obstacles are regulatory, reimbursement, and for some patients, the technology could be an issue. The not being with their provider face-to-face could become an issue. Elderly patients, isolated patients.
For many illnesses and emergencies, it will still be critical to make a physical trip to a doctor's surgery or a hospital. But with the pandemic increasing access to these virtual house calls, for non-urgent care, they may continue to be just what the doctor ordered. Gregory, TRT World, New York.